AJ's 17 years old now. We first found out that he had cancer. He was 13. He was 13 years old. We found out that it was osteosarcoma cancer, bone cancer. By the time that they caught it, he was already stage 4. I believe it was his second chemo. His lungs collapsed. This is the raw oil form that we get when we buy it. When he would wake up, he would be crying in bed, screaming for me. He was in so much pain, and I would give him 2 Oxycontin at 6 o'clock in the morning.
And he wasn't eating, and he was vomiting all the time?
Yes.
But you know what's amazing is, you know, when she brought us home and she says it's a sesame seed size, you know, half of it, and you look at that. You look at what size that is. Within 3 days, he was off all the pain pills. He was eating.
It was like, wow. It was like amazing. Monday or Tuesday when we started it. By Friday, he was taking 1 Oxycontin all day, and it was just like, something's happening. I don't know what, but something's, it's good. Around 3 months into doing this, Dr. Storch looks at us and said, he looks like he's getting better. I can't explain it, but his scan is clear. There is no more tumors in his chest. 4 months, 20 tumors, gone.
I have over probably 300 pediatric patients using cannabis right now. I have a case report of a 16-year-old who came to me a year ago, April, with a stage 4 osteosarcoma. They came in referred in by an oncologist, so bravo to her for sending the patient to me. He started cannabis oil in April, and in July he had PET scan, CT, MRI, and a bone scan, all negative for disease, which is really incredible. He had repeat scans in November, which were negative. I called his oncologist and I said, what do you think? And she said, well, he should be dead. I just saw him last week. His hair's growing back. He's off chemo. He's a little bit beat up from his 3 years of chemotherapy. For about the first 8 months of his treatment, he was on gemcitabine, which is, in one study, synergistic with cannabinoids to increase cancer killing. It appears so far that we're getting some good results. I never say cure with cancer because I don't know, but I definitely say extension of life.
We do, in fact, promote whole plant extracts. You have to have the entourage effect. You have to have the synergy between the terpenes, the flavonoids, everything else that's in the plant, in addition to the cannabinoids that are in there. And even the cannabinoids working together have a synergistic effect.
What I'm going to tell everybody is that my patients are getting medicine, my patients are getting better, my patients have better quality of life. And so it is imperative the rest of the country follows California.